a 70-pound dog with joint pain, what would be sort of your line of thinking around where to start? And then maybe not any recommendations, but just some general considerations maybe for this case.
This one's right up my alley because we see these dogs every day. First thing that we'd be concerned with is the pet's weight. 70-pound dog, we probably we will see some pets that have arthritis in their elbows or their shoulders, but if we're going to play the odds, most of them are probably coming in because they have arthritis in their spine, their lumbar spine, or their hips and knees. But regardless of where that pain is coming from, a good body weight is critical. So, as you know, a lot of our pets are overweight and they're getting poor nutrition. So, nutrition and having that talk is critical for us, whether or not the owners are willing to upgrade to what I might consider a better quality kibble or dried food, or in some cases a canned food, or even a freeze dried or raw food, or if we can get them to upgrade to a raw food or a fresh cooked diet, even partially improving their nutrition, it's in any way, I think makes a huge difference. And of course, adjusting that body weight. And then for us, my next line of thought would be, are they getting, we're big fans of glucosamine and the omega fatty acids for that joint health. And so I'd want those owners to get started with that. We generally use oral products, but we do have an injectable that can be used. It's licensed in dogs, and we do use it in dogs and cats. That's a little more expensive than the oral products, but for some pets, it can actually work better. And some owners we teach to give injections because they just go under the skin. But regardless, we want them to get some sort of glucosamine and certainly a good quality omega fatty acid for joint health. And then from there, I'd want to build with something. A lot of our patients will come in on traditional medications for pain. Perhaps those medications aren't working. Perhaps they're working, but the pet is experiencing side effects from that medication. So, of course, just like in people, we worry about effects on liver and kidney and stomach and the side effects of those medications. Perhaps we need to deal with those, whether or not they presented a clinical problem or not, that the owners have noticed or their primary care veterinarian have noticed. A lot of owners are cognizant of the fact that maybe they shouldn't be using, for instance, the non-steroidal medications can be corrosive. And so we want to talk with the owners about what their expectations are, because certainly I think we can make a dent in the pet's comfort. But as you know, the things that we're doing don't work fast. So we've got to have that conversation about, maybe we need to continue using the medication for a bit while we work our natural things in. Maybe we need, for some of our patients who aren't getting any medication or it's in the improper dosage, at least in my opinion, or perhaps there are some medications that we might suggest in the short term with that idea of, hey, you came here because your pet is uncomfortable. I want to help turn that around as quickly as we can, but still institute some natural things to looking at the long game and what our goals are. And so we may make some medication adjustments. The other thing that we'd start then is certainly some herbs. Maybe if it's an arthritic pet, we might want to think about Corydalis or something else. I'm a big user of essential oils, and we've got a nice formula that's a topical that's made for pets, made for dogs, that we would send owners with, unless they have some sort of objection themselves to using something that's got an essential oil scent to it. That might be a good start, at least for us, for getting on a first date, so to speak, a scenario for things for them to get started at home. And then it's the physical stuff for us. Certainly, I'm going to examine that dog for chiropractic problems and pitch doing chiropractic care. Probably going to want to discuss acupuncture for that dog. There are some massage techniques that I instruct owners on how to do at home. And at least pre-COVID, and hopefully when we get back to a more natural way of doing business, a number of our staff are trained in massage therapy, and that's something we offer in our office and the patients really benefit from, the patients really like, and the owners really like the results they see from that. So that is another physical thing that we can do for them. And then we haven't discussed it yet, but the other modality that we have in our practice that we really like is we have an underwater treadmill. So that's certainly a 70-pound dog that's arthritic. They really benefit from getting in to that warm water and doing some low impact exercise in that water.
Excellent. Wow, that was just a big sea of knowledge you just dropped on all of our listeners. So thank you for running us through that case.